welcoming our nurse consultant for ProsTIC at Peter Mac. So this is Elizabeth Medhurst. Thanks, Liz.
Thank you. It's nice to see so many people staying for the afternoon session, so that's really great. So my name's Liz Medhurst. I am a nurse consultant. I've worked at Peter Mac for the last 7 years, but have been in dedicated PSMA Theranostics for the last 3. And I really want to spend the next sort of few minutes talking about why you need a nurse in your service and what they can do to not only improve the quality of your service, but also improve the outcomes for our patients. But I want to take a step back just for a second. We've seen a lot of these scans today, but it's really important that we remember that they're people. They have lives before they had cancer. They're in this kind of setting, we're talking about men with advanced disease. They have disease-related side effects. They have symptom-related side effects from other treatments that they've had. And we have to kind of have a holistic view when we look at these patients. And that's really what nurses do, is we look at patients holistically and we look at all aspects of their care. So why do we need nurses? Specialised knowledge. Well, you wouldn't all be here today if you didn't want to learn about PSMA Theranostics, and that doesn't change for nursing. I think nurses need to be educated in these kind of really unique treatments, and having a specialised nurse that just focuses on one treatment, it really allows expert knowledge. Symptom management, we've talked a little bit today about the symptoms of treatment. These are all very unique to PSMA Theranostics, so having a deep understanding on how to combat them and how to make patients as comfortable as we can is really important. But also education. We educate about side effects, we educate about radiation safety, suitability and clinical trials. That's a big part of our role, so making sure that it's not just educating the patient but the wider team. Coordination of care. So I think this is really important, and especially as we move into this space with advanced disease, is that we have patients that now have multiple caregivers involved. So we have medical oncologists, they've got a radiation oncologist, most of the time they've got a urologist that they first saw when they were diagnosed. Who do they go to? I've worked in the healthcare system for the best part of 10 years now. I still find it challenging to navigate. It's really challenging for our patients to navigate as well, and that's what nurses are really here to do. And we're very good at communicating with the wider team and making sure everyone's across the patient. So that's all. Continuity of care. I think for me at our centre, I am the voice that they hear on the phone every 3 weeks almost. So I am responsible for checking the 3 and 5 week bloods at our centre. So the patients get very used to seeing me and hearing my voice over the phone. Our doctors rotate through clinics, so you don't always see the same doctor every time you come in for therapy. But just knowing that there's someone there that knows who you are, that has an understanding of what treatments you've been through before, is really important for patients. And that allows us to tailor our emotional support as well. So, often nurses are the first point of call. I think we develop a very different relationship than what medical staff do with their patients. And we develop that over a long period of time. Some of my prostate cancer patients, when I was working in urology, I would have known for 5+ years. We're different in how we provide empathy and support, and we want to create a supportive environment for our patients and their families to be heard and understood. And my last point is advocacy. And if we go back to these patients, when we're talking about last line therapy, everyone has different views, everyone has different life goals, everyone has different experiences. And it's really important for the patients to understand that someone knows that their voice is being heard, that someone knows what their goals of care are, that we can sit in an MDT and go, oh, let's list off all these treatments and let's do a liver biopsy and let's do some additional scans, but that actually may not be important for the patient. The patient may just want good quality of life. What can we do to support that patient? What can we do referrals can we put in for those patients' care? So I think that's really important, and I think nurses are very good at doing that, and I think it's because all of these things interconnect, right? And this is what we do as a whole. So looking at these patients holistically, making sure that we take into account all their bigger grand scheme of what else is happening in their lives, what treatments they've had before, is really important. So hopefully you'll all hire nurses after this. Thank you.